This is part 2 in our series on sciatica-like pain. In this episode, I will go over some common treatment methods for sciatica, specifically treatments done by an orthopedic surgeon, physical therapists, and chiropractors. The goal of this episode is to allow anyone dealing with sciatica-like pain to be sure they get the best possible outcomes for their injury and on the path to getting it fixed for good. I hope you learned something new and enjoy the show. Welcome back to the Injuries Explained project, where we are on a hell of a mission to make chronic injuries obsolete by helping anyone that is injured and in pain get properly educated and informed on all their treatment options so they can have the best possible outcomes without ever having to resort to pain pills, injections, or surgeries, which only make things worse. My name is Dr. Matt Maggio. Thank you so much for stopping by and checking out the show. Just a quick disclaimer before we get started. All of the information presented in this episode is strictly my opinion and in no way, shape, or form should be misinterpreted as concrete medical advice or recommendations. If you're currently injured and in pain, please reach out to a qualified medical practitioner for a full diagnosis. If you've already done that, you're frustrated as hell, you just want to know what's going on and get on the path to actually getting your problem fixed and solved, you can reach out to us directly and request an injury consultation. All of the information to do that is available in the show notes or wherever you might be consuming this content. Now that we got the boring stuff out of the way, let's get into the show. So this episode is a part 2 in our sciatica-like pain series in the last episode, which is actually episode 8. If you haven't listened to that one yet, you want to go and listen to that one first because you're going to have all the information to get the most out of this episode. So in that episode, we covered exactly how to tell where the pain from the sciatica is coming from, specifically by what activities make it better or worse, and then the type of pain that makes it worse as well. I always say in my own clinics and when I'm training other practitioners is we can't apply the correct treatment until we know exactly where the problem is in the first place. And that's so much of what's going on in the current medical model. You just go into a chiropractor, a physical therapist, an orthopedic surgeon. They just go, well, this is what I do and this is what you have. And they just start hammering away. I always use that analogy. Like imagine if your car's check engine light came on, you took it to the mechanic and they just started hammering away on shit and got in there and bashed it with a hammer, put a bunch of stuff on there, but they don't know what's going on because they didn't run any tests. You got to know what's going on so you can actually fix it. So many providers out there are just throwing stuff at the wall and seeing what's sticking, and then people aren't getting any better. They're frustrated. They're not getting the results they need, and then they're having to resort to like pain pills, injections, and surgeries, which just mess things up and ruin people's lives. So we have to get back to the idea of letting the practitioner figure out exactly what's going on. And if you go to a provider that just starts jumping into treatment right away before ever figuring out exactly what's going on, they're never going to be able to help you. And they're actually going to make your problem worse because you have a window of opportunity where things can get better and they can improve with quality treatment that isn't pain pills, injections, or surgeries. But if you're not getting the right treatment, you're actually going to have to deal with that problem a little bit later down the road. So go back and listen to that last episode, episode 8. So now that we know where the sciatica pain is coming from and located, I'm going to take some time to kind of get a little bit nerdy and explain what's really happening here. So basically what's happening is there's scar tissue getting stuck to the sciatic nerve. It starts up in the back and then it makes its way down through the back, in through the hips, in through the hamstrings. And in the last episode, I kind of gave you an idea of like how to figure out exactly where that nerve is getting stuck. But over time, nerves are kind of built with like some slack and some extra movement, kind of like a rubber band. They have to make their way through muscles and fascia to get where it needs to go. And it's got like that 15% of extra slack like a rubber band. But over time, with poor posture, not moving enough, overwork, underwork, all that kind of stuff, the muscles don't get enough blood flow and they don't get enough oxygen. And they develop this stuff called scar tissue. Everyone knows what scar tissue is, but over time, that scar tissue gets way bigger and it starts to spread out and eventually it gets stuck to the nerve. And it presents with some symptoms like numbness, aching, burning, tension, and pain for sure. I did a deep dive on scar tissue, more in how it forms and what it causes in episode 2 if you want to go in and like really get all the nerdy details, or if you haven't listened to that. Because I get a lot of people that reach out and they're like, well, how in the hell did I get scar tissue? I never had an injury in there. I cover that in episode 2. I'm not going to bore you with that. Go back and listen to it, and it'll really help you understand why scar tissue is a big deal, why it is the most common cause for decreased flexibility, pain, and weakness in the human body, and it is the most fixable, but also the most underdiagnosed. So essentially, the scar tissue is like a glue that gets stuck to the muscles and nerves and causes a majority of the issues with sciatica leg pain: numbness, aching, burning, tension, pain. So I guess there's 3 providers that I wanted to cover in this episode, and their treatments to help fix. I did it with quotation marks, fix, because they're actually not fixing anything. Treatment involves actually removing the problem and getting fixed for good. You can temporarily feel better, but if you're not improving the function, it doesn't fix anything. So let's start with my favorite people, the orthopedic surgeons. They are not my favorite people at all. I think they do way too many surgeries. They have a God complex. They think that they can fix everything with surgery, and they end up ruining a lot of people's lives, and just getting paid for doing a bunch of procedures that actually don't fix anything. But usually an ortho is going to want to start with some injections, maybe a cortisone shot, maybe an epidural. I covered all that in episode 3. The reason I made those first couple episodes to have reference points to go back so that I can really just give you more detail in the episode itself and not have to like draw it out in there. So go back and listen. That one's episode 3, as I said. But the issue here is that it might take the pain away, but over time, it makes the tissue a lot worse, and it will develop more scar tissue. So sometimes people will temporarily feel better, but they're going to have to deal with that problem down the road. I always say a treatment that only gets rid of your symptoms but does not improve your function is actually dangerous, and it's going to be a lot harder to deal with down the road. Covered that more in episode 3 about why injections are garbage, and the doctor that gave them to you is garbage as well. I am never shy about sharing how I truly feel about stuff like that. Then the other thing they might do is they might do surgery for your sciatica. Here's the thing about getting surgery for sciatica-like pain. It can take the pain that's going down the leg away, which is actually a criteria to have the surgery approved by the insurance company. But here's what they don't tell you. It will actually make your back pain a hell of a lot worse. So yeah, they'll get your pain down the leg away, but you're gonna have to deal with a lot more back pain down the road. And that's why people are getting multiple surgeries, and it's called failed back surgery diagnosis, because they're getting rid of the pain down the leg, but it creates more problems up in the back and up in the hip as well. And plus, I always say, surgery creates more scar tissue. So there you go. Now you're going to have to deal with this problem even more. And like I said, they literally have a diagnosis code called failed back surgery. Physical therapists, my second favorite people. Don't like physical therapists either, because they think everything has to be an exercise or a stretch or some type of modality, but they're just usually not very good at getting in there with their hands and actually breaking down the tissue and being good. But I digress on that. So they're going to tell you 2 things when you come in with sciatica pain. They're going to say your muscles and your tissues are either tight or they're weak. One of the above, or a combination of both. You got some tight muscles and they're really weak. So if they are tight, then they tell you to stretch it. And if they're weak, they tell you to strengthen it. But when it's tight and weak, it's actually done for a reason, to protect the nerve underneath getting stuck. Because if your nerves don't work, the rest of your body doesn't work at all. So a lot of times those muscles that feel tight, feel like they need to be stretched or just can't function. A lot of people say the muscle isn't firing. It's not firing or stretching for a reason, because the nerve is stuck underneath there. And if they let that muscle relax, it's going to put more pressure on the nerve and cause that problem to get worse. So if you temporarily get the muscle to relax by stretching or exercise, it does expose the area and can cause bigger problems down the road. I always say this: think of the sciatic nerve like a tooth with a really bad cavity that needs precision drilling to get that nerve free. Not like a surgical type of intervention, but needs precision drilling to get in there. Now, stretching and strengthening are kind of like brushing and flossing your teeth. When it's a really bad cavity, it's only going to piss that off. It's past that point. So physical therapy is past the point once the injury actually settles in. I cover that more in another episode. I forget which one it is, but go through why physical therapy actually work. And then lastly, the chiropractors. I've been pretty honest about my view on chiropractic. I have a whole episode where I share with you why adjustments don't work. They actually make things worse. I went to school and got a degree in chiropractic. Doesn't do anything. They don't do anything. So The chiros don't even bother with the muscles, and they think everything's a bone problem. So don't even bother with them for sciatic injuries, especially if they're chronic ones. Like I said, they might get lucky with like short-term low back pain where you think it's actually fixed it. A lot of times that body just gets better, but you got chronic low back sciatica pain. I'm talking like 6 years, not 6 years, 6 months, 9 months, a year, multiple years. You're not going to get any relief with an adjustment in that short term, and it's actually going to make the problem a lot worse. So now that you have no hope that any of the common treatments can work, I've already said surgery, injection is going to make it worse. Physical therapy isn't the right tool. It's like trying to fix a cavity by brushing and flossing, and the chiropractors aren't even getting close to addressing the soft tissue injuries. What can you do? I always I don't want to be doom and gloom, like, oh, everything else sucks out there. You have to deal with your problem and that's it. There are some specialized manual therapy providers that specifically specialize in finding and fixing those nerve entrapments caused by scar tissue out there. What they're able to do is effectively break down the scar tissue and remove that nerve getting stuck without injections or surgeries. What they're able to do is get in there very precise and very focused with their hands and break down that nerve entrapment the same way they would try to do it with surgery without all the risk, without having to go under anesthesia, without having to get an infection, all that stuff. So what I want to include in this week's episodes in the show notes or wherever you're consuming this, I'm going to include 2 videos of what the treatment would look like performed by one of those providers that specialize in this very advanced, specialized, revolutionary treatment. So be sure to check them out. I'm going to show one treating the sciatic nerve in the hip, and I'm going to show another one treating scar tissue in the low back around that sciatic nerve. So that's all I got for you guys today. A couple things I want to remind you of. Continue to ask questions about what's going on with your injury. Don't settle for surface answers and providers not knowing what's going on, where they just have you come in and are like, we're going to try some random treatment and see what happens. And then also continue to get multiple opinions and be proactive in your injury treatment process. And if you're looking to get access to one of those amazing providers that I'm going to share that video of that, just send us a message. And we have them from all over the world. We train providers from all over the world. That's what we do as well. We train other providers how to be excellent at this type of treatment, and they make a big difference, and they help people get out of pain for good without injections, pain pills, or surgeries. Please support the show by sharing with others. And if you're looking to get real answers about what may be going on with your own injury and you're tired of getting jerked around by the medical system, then please reach out and request an injury consultation with our team. All of that info is available in the show notes or wherever you're consuming this episode. Thanks for listening, and we will see you on the next one. Bye.